This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt with Regence Blue Cross Blue Shield of Utah. Let's talk about whooping cough for a moment, Doctor. We had this recent outbreak at Corner Canyon High School in Draper. So what's this about an outbreak there in Draper?
That's right. At Corner Canyon High School in Draper, Amanda, there have been so far 5 confirmed cases of whooping cough, which is also known as pertussis.
Why whooping? What's the whooping and whooping cough here?
Well, it's because of that high-pitched whooping sound that many infants affected by this disease make after they complete these fits of rapid, almost uncontrollable coughing. As they try to gasp for air, they make this high-pitched noise.
But adults can get this too, right?
They can. Although most of us have been vaccinated as children, the problem is that the vaccine is not entirely effective. And even if initially effective, its protectiveness wanes over the years.
So how long do students at the school then need to stay away from school?
Brian, this whooping cough is highly contagious. It's caused by a bacterium, and so people who are infected by it do need to stay away. And the recommended length of time staying away is for 3 weeks after the coughing has commenced, or once you've completed a full course of effective antibiotic therapy.
Okay. All right. I have to ask you about this. So we heard about acupuncture using bee stings and that was becoming popular. What's that all about?
What?
This is acupuncture therapy using live bee stings. It's known as apitherapy. It's becoming more widely available, particularly in Asia and Eastern Europe.
So what's it used for?
Well, here in this country, Brian, it's used mainly for pain. So
Wait. Bee stings are used to combat pain?
Like they literally bring in bees and they'll just sit them on your body and...
It's also non-intuitive, but yes, to combat pain, specifically arthritis. And it's also known to be successful in treating those with multiple sclerosis.
Are there any risks involved?
There are. Of course, you can have a reaction to a bee sting.
Yeah, sure.
In fact, recently a woman in Spain died. She had been receiving this therapy monthly for 2 years without effect, without reaction. But apparently, suddenly she developed this sensitivity and she died from anaphylactic shock.
Do you know how it specifically works? Do they put something on your body to get the bees to sting you, or how does that,
Well, sometimes they actually get the bee venom and put it into the needles.
Oh, okay.
And then through acupuncture technique, inject you with that venom.
Not necessarily the bees themselves doing the stinging. Man.
How interesting
stuff.
All right. Thank you as always, Doctor. We'll see you next week. This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
KSL